name is Laake, and I'm an infectious diseases physician at Prevea Health. As an infectious diseases physician, I treat patients with all kinds of infectious diseases, everything from viruses and bacterial infections to fungal infections. That can include lifelong infections like HIV, or it can include sort of short-term bacterial infections like pneumonia. I think the most important thing is that patients understand what's going on with them. So I think particularly in the first meeting, patients can expect that we'll sit down and talk about what's going on. I'll explain the process of their infection and what their treatment options are. And hopefully we'll be able to work together to come up with a treatment plan that they are comfortable with. I think the most rewarding part of infectious disease is that a lot of times you can take patients who are really quite sick and the disease process can be turned around. When people have acute bacterial infections in the hospital, it's extremely rewarding to see people go from being extremely sick and in a hospital to following them up as an outpatient and watching them just get back to their normal lives again.